Did you know that diet could be the answer to your struggles with frequent urination, waking up in the middle of the night, difficulty with starting urination, and/or weak stream? Millions of men face these problems every day, and it's due to something known as benign prostatic hyperplasia, or BPH. The foods you eat can and do make this worse. My name's Dr. Taranella, and this channel is dedicated to helping you understand, improve, and optimize your health. And today we're diving into specific foods that can make your enlarged prostate worse. I'll give you the research and my own clinical insights that will hopefully help you make the most out of this information. If you're liking these videos and getting a lot out of these videos, don't forget to hit the like and subscribe button to continue getting videos like this. All right, let's jump into the video content on how your diet might be affecting your prostate health. So benign prostatic hyperplasia, also known as BPH, drastically impacts the quality of life for those that are suffering with this, causing pain, pressure, frequent urination at nighttime, which cause you to wake up, and even incontinence. And while medications and surgeries are the common treatment options, diet also can play a critical role, a very useful role in helping you get out of these stressful and negatively impacting symptoms. First, though, what is BPH? So as I said, BPH stands for benign prostatic hyperplasia, and it is a benign growth in the tissue of the prostate, and it's often linked with inflammation. And so inflammation and metabolic syndrome are two of the key dietary influences that we're going to be looking at and discussing. So we said that BPH is this benign growth of the prostate tissue, which is being influenced likely by inflammation in those cells in and around the prostate tissue that's causing those cells to want to expand and grow. And so what we want to look at first before we get into the specific diets is a little bit more on what actually is going on with inflammation. It's essential to understand what inflammation is and what's going on and what we mean when we say inflammation. And not only that, what are the components of inflammation that allow that process to go forward? What is needed to create inflammation? So we can say in a very basic sense that inflammation is increased immune activity. And this generally means more immune chemicals are being produced in conjunction with that increased activity because the chemicals bring on more immune cells. And those immune chemicals are called cytokines, and there's different types of cytokines. Some of them are known as eicosanoids. These different eicosanoids or cytokines can be pro-inflammatory or anti-inflammatory. And the balance between these chemicals partially is influenced by what's going on with your immune cells, but also what's going on with the fatty acids in your cell membranes. Your cell membranes are basically a bilayer of fatty acids. And so when you have more arachidonic acid, which is a type of fatty acid from red meats, more of that in your cell membranes, you're going to have more pro-inflammatory eicosanoids, which tends to worsen inflammation. You can think of this kind of like a forest fire and doing controlled burns. When you do controlled burns, you reduce the fuel that's available for that fire to keep going. And in the similar way, when you reduce the arachidonic acid, you're reducing the amount of fuel that inflammation has to go forward. So we said that these eicosanoids can be either pro-inflammatory or anti-inflammatory, and what partially influences whether or not they're going to be pro-inflammatory or anti-inflammatory is the available fatty acids. What fatty acids are available to the tissues when they get damaged, if they do get damaged, what sort of chemical message is produced from that. So on a very basic level, we're saying that the fatty acids that are present in the cell membranes, if and when those tissues do get damaged, and those fatty acids that are in those cell membranes are then going to produce a certain pro-inflammatory or anti-inflammatory cytokine that's then going to bring more immune cells or less immune cells to the area that will then keep that inflammatory process going. And so in a very general sense, the food that you're eating on a daily, weekly basis is basically setting up those cell membranes to have either a controlled burn or a uncontrolled burn when that initial fire gets set off. And that's not to say that the arachidonic acid, which is going to end up producing more of those pro-inflammatory cytokines, is all bad. It's really when there's an overabundance of it, when the inflammatory process gets going and it's no longer able to be controlled by the counteracting forces in your immune system, the counteracting forces in the cell membranes. That's when there's going to be a problem, and you want to think about maybe shifting some of those cell membranes, some of that fatty acid content in your cell membranes. Okay, so now let's look at some of the studies on BPH and diet. So as you might have guessed, what we want to look at is fatty acid content and how it may be affecting your BPH. And one study looked at this, looking at over 5,000 participants in their dietary risk factors, how that influenced whether or not they got BPH, and they were free of BPH at the baseline and basically studied them over several years. And what they found was that diets that were high in total fat and specifically higher in red meat were more associated with increased risk of symptoms of BPH, those symptoms that we discussed before. On the other hand, diets that were higher in protein, higher in vegetables, and also consumed more alcohol, they were associated with a decreased risk of having BPH symptoms. And specifically, they found that men eating red meat daily had a 38% increased risk of BPH compared to those that were only eating red meat, say, less than once per week. Similarly, men eating 4 or more servings of vegetables daily had a 32% decreased risk in BPH symptoms. And that was compared to those that were only eating 1 serving or less. So this research is definitely helpful. It gives us some clues about what could be going on here, but it's certainly not definitive. It's important to have good theory and reasons for why certain diets might make a difference and might cause people to have more symptoms or more enlarged prostate, and make your enlarged prostate symptoms and enlarged prostate actually worse. And it does seem like there is good theory here, but this also doesn't mean that all cases of BPH or these symptoms that are associated with BPH are from eating red meat or eating more meat. Certainly something to consider when your options for treatment are limited. You basically want to, look at everything possible that you can do to help with this versus going under the knife or surgery or taking medications all the time. So to me, what this research suggests is that increased red meat consumption, you're going to have higher arachidonic acid coming into the body. And in fact, all animal protein contains more arachidonic acid when we compare it to plant-based proteins, but it's particularly high in red meat. So when you consume more fat in general, you're consuming more arachidonic acid, generally speaking, but not always. If, for instance, your diet is high in omega-3s from fish, you're not going to be having this problem with higher arachidonic acid. Things like turkey and chicken also have less arachidonic acid, and nuts and seeds don't really have any. So high-fat diets aren't necessarily always going to contain arachidonic acid, and therefore probably won't necessarily increase your chance of BPH. But when and if it has more of the saturated fats, and in particular, if it's coming from red meat, I think that's when you have to be extra careful. And so it looks like high-fat diets through this arachidonic acid do promote BPH through providing the raw materials for your body to promote this inflammation in your prostate tissue. But it's actually happening in all your tissues. It's not just the prostate. And again, it's providing the fuel, but that doesn't necessarily mean that that match is going to get lit. For instance, when we want to reduce inflammation because we have a sore knee, we're usually going to take something like ibuprofen that's going to inhibit the COX-2 enzyme. This ibuprofen is inhibiting the enzyme, the same enzyme that produces those pro-inflammatory molecules that are coming from the arachidonic acid. And so there's no question that arachidonic acid is a source of inflammation, and that increasing arachidonic acid tends to increase inflammation. But we can't have zero inflammation either, because that's part of what allows our bodies to fight pathogens and have a good immune response when we need it. And so this isn't a one-size-fits-all, but it's definitely something to look at. Another thing to consider with higher fat diets is that there's an increased absorption of something called LPS. LPS is lipopolysaccharide. It's a bacterial toxin that promotes inflammation. And according to the research we just looked at, this kind of eating pattern definitely exacerbates prostatic enlargement. So for sure, this isn't a closed case on arachidonic acid. Each form of BPH, like any disease, is going to be a bit unique to each person, and there's multiple causes, multiple things going on. that can cause these symptoms. Inflammation is definitely one, and you shouldn't overlook this. Another angle to examine, as we alluded to in the intro, is foods that are going to promote more of a metabolic type of syndrome. These are things like diabetes, prediabetes, insulin resistance, because these have been shown to increase prostate size. High insulin levels and insulin resistance is basically the hallmark of metabolic syndrome in type 2 diabetes. And as these conditions progress, the amount of insulin produced as the disease process gets worse also increases. And so one study looked to evaluate the relationship there between metabolic syndrome and benign prostatic hyperplasia. And what they did is they looked at the annual growth rate of the prostate tissue. And so they took 78 patients with lower urinary tract symptoms suggestive of BPH, and they were divided into two groups, whether or not they had metabolic syndrome and those that did not have it. The group of men that had metabolic syndrome had significantly higher PSA levels, and their annual prostate growth as measured by the PSA was also significantly higher. So this and other studies like it suggest that foods that increase insulin, increase metabolic syndrome will make your enlarged prostate worse. And managing insulin resistance with a lower carb diet could potentially mitigate some of the worsening symptoms or even some of the symptoms that are present with BPH in your body right now. So high-fat diets like ketogenic diets or carnivore diets, things like this are going to definitely increase your arachidonic acid intake, but they're going to lower your carbohydrate, lower your insulin resistance. So what do? Well, the decision may not be as binary as it seems. You can do a little bit of both. After all, a healthy diet is a balanced diet. So while a ketogenic diet is a low-carb diet, you don't necessarily need to follow this extreme type of diet to lower your insulin resistance and your blood sugar levels. A low-carb diet just means you need to be lower than it is right now and make some changes, and that's going to have an impact on your blood sugar and on your insulin levels, and hopefully on your prostate growth. The same is true for low saturated fat and also low red meat diet. It just has to be lower than it is now. And depending on how severe your symptoms are and how quickly you're expecting to see a change or need to see a change, how poor your diet is now as well is also going to determine how much impact that dietary change is going to have on your symptoms and your BPH overall. But I also wouldn't discount the impact of small changes over many months, like 6 months or more. The lesson here is more about where you're at right now in comparison to these two extremes, high carb, high fat diet. If you're consuming really high amounts of carbohydrates and really high amounts of saturated fat from red meat in particular, bringing both of those down a little bit may really help you. If you're eating a very low carbohydrate diet and very high red meat diet, you may need to shift this up a little bit and come into balance a little bit more so that your BPH symptoms can kind of relax and reduce. So what are the foods that make enlarged prostate worse? For sure, it's going to be red meat, and that means meat coming from animals with 4 legs, more so than those with 2 legs, and also foods that are higher in carbohydrates, particularly those on the glycemic index, which you can look up if you want to know what the glycemic index is, but those are more likely to raise your insulin. And just so you know, too, I've had patients in both of these camps where they were really high in red meat and moderate in carbohydrates. They drop this down, move this up a little bit, and suddenly their PSAs drop very low and or their symptoms improved. And the other way too, they were kind of a little bit more on the carbohydrate side and not so much on the red meat or overall protein. And you change that and suddenly their BPH symptoms get better as well. So here are some good rules of thumb to follow to manage and potentially reduce your BPH risk with diet. So you want to reduce red meat and processed meats in particular to less than 1 to 2 times per week. Unless you're already doing this, and if that's the case, you might want to reduce it even further. Second is to limit high-fat foods in general. These could be other unhealthy types of fats that are not necessarily from red meat, but they might be fried foods, deep fried foods, French fries, things like this. And you also want to reduce your intake of high glycemic foods. So these are going to be things like sugar, rice, pasta, bread, fruit juice, and things like this. And along those lines too, you want to try and limit your total amount of carbohydrates to around 100 or so net grams per day. And that would be for a 70 kilogram person. So if you're a little bit more, you may need a little bit more. If you exercise more, you may need a little bit more. But if you're, at 200, 300 net grams per day, it kind of tells you where you need to go. And something that we didn't really address in detail, but it's also noteworthy, is to increase the amount of antioxidant-rich vegetables and fruits. This is what you're going to replace for some of those high glycemic index foods. So understanding the impact of diet on BPH is crucial to managing your symptoms. And by making these more informed dietary choices, you can definitely reduce your overall inflammation in your body and reduce your symptoms of BPH and actual prostate size. Remember, small, consistent changes can lead to significant improvements over time. And hopefully this information was helpful. If you have questions, let me know in the comments section. If you want a more nuanced, detailed answer, consider joining the membership program, where I will have more time and attention to dedicate to your questions. Now, one question you might have after looking at this information is, how do you keep your PSA in check when you're on TRT or testosterone replacement therapy? You can check out that information in this video here.